Hey everybody, welcome to a new episode of Wander. Yeah, this one's an interesting one to me because I think it's one that we all kind of get caught with from time to time in different ways that we don't really even notice. It's all about obesity and how we can. One of the things it's about is how tough we can be on obese people. And two, it's just how complex the solution to obesity is. And today I talked to, her name is Ximena Ramos-Salas. She is the executive director of Obesity Canada, and she's working with that organization to change our perceptions of obesity. You know, it's not as simple as just saying, well, eat less, work out more, and all your problems will be solved. Why can't you do that? Yeah. That's really what the discussion is about today. She's incredibly intelligent and sweet, and it was a really fun conversation. So I hope you can get past the first 5 minutes where there's a little bit of typing in the background, but we solved that issue, and I had a great conversation. So enjoy the podcast. Let me know your thoughts. Let me know your thoughts on the Facebook page. Send me an email. I always want to get feedback. I like feedback because I want to make the podcast better, and I want to know what other people's perceptions are, because I can only ask the questions that I think of, but I want to know what you think of what you hear. So let me know. Anyway, here it is.
Welcome to Wander with Andrew Wilcox.
So my name is Ximena Ramos-Salas, and I'm the Executive Director of Obesity Canada. Obesity Canada is a not-for-profit registered charity based in Edmonton, Alberta, and we're actually hosted by the University of Alberta. But we're a national organization, so we have members across the country as well as international members. And the members are people who are either doing research or are working in healthcare or in industry in the field of obesity. And the initial idea of Obesity Canada was that we wanted to break down some silos that were happening in the field of obesity. So you would have researchers working in nutrition, going to their own nutrition conferences, and you would have researchers working in physical activity, going to their own conferences, and then geneticists meeting in their own. And so we wanted to bring everybody who's working in obesity research together to try to create more collaborations between researchers to try to find better solutions to obesity. And so we got a grant in 2006 from the federal government, from Industry Canada. It was a Networks of Centers of Excellence grant. And the idea was exactly that: bring together the community of obesity researchers and healthcare professionals and try to translate the science that we have in obesity to healthcare practitioners as well as to policymakers. And my background as I came into the organization was that I've always been interested in disease prevention, so health promotion, and how do we promote healthy living, etc. So I have a bachelor's in kinesiology and a master's in health promotion, and then recently I just finished my doctorate in health promotion. And when I started working for Obesity Canada, I had just finished my master's in health promotion, and my thesis was exploring how newcomers, people who come from other areas of the world to move to Canada, how they after 10 years of living in Canada usually tend to gain a lot of weight and can become at risk for obesity or develop obesity within 10 years of living in Canada. And so I wanted to explore why that was happening. Why when Canadian newcomers come to Canada, they come healthy and very, motivated to live in a new country, but then within 10 years, their health deteriorates significantly. And I found that obesity was a key risk factor to their health deteriorating. And of course, as a health promotion researcher, I was looking at all the factors that lead to obesity, the social as well as the cultural factors, as well as the genetics and biological factors. And what I discovered with newcomers was that, coming to Canada, it wasn't just about the lifestyle change. it was also about the stress that immigrants face when they move to a new country and how difficult it is to integrate into a society, difficult to learn the language, difficulties finding a job. And that creates a lot of social stress and personal stress that can actually increase risk for obesity. So it wasn't just that they were not eating the same foods and not moving as much as they were doing in their countries. That changed for sure.
Yeah.
But it was also the stress that people experienced by moving to a different country. So my background is really in health promotion, and I like to explore all the social as well as the cultural and physical and environmental factors that lead to obesity. And I've always understood that obesity was a very complex disease. However, in none of my background, so I'm originally from Chile. I moved to Sweden as a refugee when I was 10 years old and grew up in Sweden in a very healthy country. I had lots of family support and social support here in Sweden. And then I was always worried that, not everybody has the same health level. So there's a lot of inequalities in our society. And when I moved to Canada, that became even more of a concern. I could see social disparities and health disparities a lot more than I could see them in Sweden. And so I wanted to find out what's going on. So I'm always really, really interested in that, the social disparities, the social issues. So that can kind of explain my bias. Like that's the lens that I wear when I talk about obesity, that I am a social scientist. I think about things in a broader way. So I guess that explains my background.
Yeah.
I'm a social scientist. I have a background. But one of the things that I wanted to point out with my education is, yes, I have all these degrees, but throughout my education, and in Sweden, I studied nursing. So I went from nursing to kinesiology to health promotion. In none of these education programs did I ever get training on obesity. I was taught that obesity is a risk factor and obesity is bad for you, and that we need to prevent it. But there was never any science about obesity in any of the courses that I took. I never got to understand what causes obesity. And throughout my training, I have to say, a lot of the narrative that I heard in my degrees and in my education was that obesity is all about eating less and moving more, and that we just need to tell people and educate people that healthy eating is important and that having a healthy weight is important, and that we can prevent obesity by simply eating healthy regularly and moderate meals and moving and exercising more. And I really believe that. As an exercise physiologist, as a kinesiologist, I really thought that that was my job, to go out there to the world and tell people to exercise and to be healthy. And so I was kind of like a little bit of I'm older now and I'm much more wise, but back then I was like, oh, of course everybody needs to exercise and eat healthy. Like, this is easy. Let's just go out there and promote healthy living to everybody. And slowly I realized that there's a lot more issues behind obesity. And as I mentioned, my master's degree thesis about immigrants and their experiences with obesity opened my eyes to the fact that this is much more complex.
Yeah, and I think that there is a certain group of people that think when they see an obese person, that's the first thing that comes to their mind. They go, well, they just need to get told to get out there and do some exercise and go for a run and eat better, and they'll just be fine. Like, why don't they just do that? Like, and you'll get told that through your life. And one thing I noticed on your website was a lot of it starts in the family. And I wonder with that if it's a lot of because there's genetic factors, if that is family members who've experienced discrimination because of obesity, putting a lot of pressure on their children to not go through the same situations that they have. Does that happen a lot?
Yeah, so there's, obviously we have a lot of science now, and we know that, weight is very much genetic, right? So if you have parents that have excess weight or overweight, children are more likely to have that as well. It's just like if you have tall parents, you're going to be tall.
You're gonna be tall. Yeah.
So it's the same issue. And then because of the bias that we have in our society, yes, parents are always very worried that their children are going to be bullied or have health problems because of their excess weight. And from my experience in my PhD, I interviewed a lot of people living with obesity, and I talked to them about their experiences with weight bias. And some of the weight bias, and I would say a lot of it, came from their families and
Mm-hmm.
their parents and their sisters, siblings, grandparents um, who intended well,
Yeah.
but were worried about them and would tell them, you need to lose weight, you need to stop eating. And I heard stories from people that said that their moms put them on a diet when they were 7 years old,
Yeah.
right? And I heard stories from people telling me that their grandparents used to bribe them to say, like, if you don't eat dinner today, I will give you $10,
Mm. Oh,
because they
geez.
wanted them to lose weight, like, and parents do this and families do this from a well-meaning
Yeah.
way. But then there was also a lot of not so well-meaning comments and messages from their families, right? There was a lot of jokes about fat jokes, a lot of comments about their bodies and their beauty, comparing their bodies to somebody who's ugly, making very hurtful comments that when you're a child, if you listen to and you hear these comments from your own family and from your friends or peers, um, it creates kind of like a scar in
Yeah.
your soul, right? And then you grow up thinking that you're not normal and that you need to change, and that everybody else is telling you what to do, but somehow because you cannot change and your weight is not going down, you're a failure. And this sense of feeling that it's my fault and everybody else knows what to do and they're doing it because they're not getting obesity. I'm the one who has obesity in my family, so it must be something wrong with me, or I'm too lazy. Like I don't have the willpower. And that self stigma actually creates worse problems psychologically, physically, as well, right? So people start believing that this is their fault. And this is what we called internalized
Yeah.
weight bias,
Well, and
right?
and I think that people just sometimes forget that each person's body is different. Like the physicality of each person is different. What it would take for one person to stay thin is not even close to what it would take for another person to stay thin or to lose weight. Because losing weight takes so much more work than maintaining weight. It seems to me, though, as
Yeah.
well, right?
Yeah. Yeah. So I guess, well, science shows that, there's lots, as you know, the weight loss industry is like a $50 billion
Mm.
industry in North America. And there's lots of diets and lots of programs out there trying to promote weight loss. And people who try these programs, they lose weight. And it's relatively easy if you stick to the program, to the diets, but whether or not you can sustain those programs in the long term, that's where the problem comes in, right? So, although we have ways to help people lose weight, the problem is trying to keep the weight off and maintaining that weight loss over the long term. There's a lot of issues that happen in the body that resist weight loss. So initially, you might lose, even patients who have bariatric surgery, they might lose a lot of weight initially,
Yeah.
but then slowly the weight loss starts being less and less. And then a lot of patients, I would say, will we don't have the exact science on it, but from a clinical perspective, we see that almost 90% of people will gain some weight back,
Yeah.
and a lot of people who have had bariatric surgery will gain all of it back. So not even bariatric surgery, which is one of our standard, kind of like gold standards of obesity treatments, is a cure for
Yeah.
obesity. We don't have a cure. We don't have effective treatments that work for everybody because, like what you said, everybody's so different. Everybody's bodies is so different, and the treatment responses will vary from person to person. And
Well,
so, whether you put somebody on a low calorie diet or you put somebody on bariatric surgery, they will lose different amounts of weights,
yeah.
right?
Absolutely. Well, yeah, everybody's different, and we don't. And our problem is we try to say that the mold is essentially one or two things, right? A woman is supposed to look like this or this. A man is supposed to look like this or this, and that's it. So we're all supposed to be aiming for that instead of aiming for healthy, which becomes really problematic, right? That's where the issues come in.
Like we all come in different sizes and shapes.
Yeah.
And there's no, which was one of my points coming out of my thesis for my PhD, was that in public health, I reviewed all public health policies across the country from all provinces and territories to look at what is the narrative that we use in public health about obesity. And the main narrative is that obesity can be prevented by eating healthy and exercising, and that there is a healthy body weight, and that healthy body weight is a BMI of, below 25, like below 30. And, the fact is that people can be healthy at different BMIs, right? And BMI is body mass index, which is really a measurement that we use for scientific studies at the population level. But it's not a tool that we use to diagnose people with obesity, right? Like it's just, we put people, this is kind of a number that we use to group people that are of a specific size. But the BMI number doesn't tell you whether that person has obesity or not. And it doesn't tell you whether a person is having any health issues related to their size. It's like a clothing size, basically.
Yeah, and people can be very tiny and very unhealthy, physically unhealthy.
Yeah, they could be smoking a pack a day.
Yeah.
And you don't.
Well, and also, but like just unfit when it comes to their, fat content to body size, right? You can still be unhealthy and be small. Yeah.
Yeah. Like I'm sure somebody who can eat whatever they want and everything they want and not gain weight.
Oh, those were beautiful days. I'll tell you that. Oh, I loved those days. Oh, I used to be able to. Absolutely. Absolutely. Up until 21 years old, I could eat absolutely anything and it didn't matter. Buckets of sugar, pizzas. We'd have competitions. I used to work at a fast food restaurant. We'd have competitions to see what most ridiculous thing we could build and then eat. Like we would get like an 8 patty quarter pounder, which is like an entire pound of beef, and then we would see how fast we could eat it, and like that would be no problem. And I would maintain a weight of 6'1" and 156 pounds, which was just thin. And then all of that went out the window in the mid-20s. And now I have to watch my weight. I have to do that. One of the most depressing, when you talk about BMI size, one of the saddest moments for me was when I was at the doctor's and I looked at my BMI and I sat in the obesity range, which I didn't think I was in. And my optimal weight was something that I hadn't seen since about 24 years old. So now in my mid-30s, I'm going, that's not even possible for me. So thankfully, my doctor was very great about it. And he was like, yeah, you don't want to be fighting for that. Because body shape, he's like, you're not going to hit 185 pounds again. He's like, that's not going to happen. He said to me, he's like, lose 20 to 30 and you'll be doing okay. And thankfully I've lost 15. So, I'm working towards that. But that's where we get this misconception. That's where the weight bias comes in. That's where I think the social issues and the mental issues come in for a lot of people, that they go, it's going to be completely unattainable for me to ever look like this, like Jennifer Garner.
It's interesting because it's the weight bias affects everybody, right? It's not just women. It's not just, it affects men as well. There's a lot of social pressure to look a certain way. And that if you look this way, that means that you're healthy and you're successful and you have willpower, you're disciplined and hardworking, right? Yeah. But if you don't look that way and your body is bigger, then all the stereotypes that we have associated with that is that, obviously you're not working hard enough. Yeah. Because if you were, then you would be smaller. Obviously, you don't have the willpower. You're lazy. You're somehow stupid. You don't get it. You don't want to help yourself. Yeah. All these negative stereotypes that we have about people living with obesity actually have very, very bad consequences for people, right?
Absolutely.
Because it's not that they internalize it and they believe it's bad, that they're bad people. It's that people treat them differently,
Yep.
right? And so if you're at the workplace and you're up for a promotion with somebody, fighting for a promotion with competing with somebody else, very likely if you have obesity, you're not going to get that promotion, and
Yep.
somebody else who doesn't have obesity will get it because of the stereotypes that HR people may have and your boss may have.
Yeah, because you're perceived as, well, clearly they, don't have the discipline to, you know, they don't have the discipline to work out. How would they possibly have the discipline to meet deadlines?
Yeah,
Like,
exactly.
as though
And it's
those
like
two things are mutually exclusive.
it's kind of like we think that a body shape is the equivalent of not only health but intelligence
Yeah.
and moral character. And, that's just very ingrained in our society. Like, everybody has it. And I think from the Everybody Matters Collaborative, which we have, it's a team of obesity researchers and weight bias researchers in Canada. That's one of the things that we need to work on, is that we need to bring awareness about the fact that everybody has weight bias because we live in a very weight biased
Yeah.
society. And so if you're not aware of it, you can't really do anything about it. But once you become aware of it, like when I started doing this research, I see weight bias everywhere, like
Yeah.
on TV, like when
Oh,
I
it's
go to the
constant.
doctor, everywhere.
It's constant. The minute you watch a biography movie and you see the actors who play in that biography movie, and then they always show that picture of what the person really looks like. If the person's larger in life at all, they're played by a much thinner person in the film. Always.
Yep.
Like, it almost seems
Yep.
like every time it's always a much thinner person in the film.
Mm-hmm.
Um, yeah, and yeah.
Also, the cartoon. Have you noticed the movies, like even kids' movies? The evil characters in cartoons is always the big
Oh yeah,
cartoon
like,
person, the character, or the ugly person or the funny person is always the big character. Like
yeah,
so, it starts very young. And in fact, one of the oldest studies we have on weight bias, they took kids that were young as 3 years old, and they put a picture in front of them of different kids with different body shapes and disabilities and different traits. And they asked the children to pick who they wanted to be friends with.
yeah,
And the majority of the children picked the kid who had a larger body last.
yeah.
So they would rather be
Huh.
friends with somebody who was in a wheelchair, for example, than the kid who had obesity. So it starts very young because it's everywhere. It's
Yeah.
in our families, it's in the movies, it's in the books we read. It's everywhere. And so if we don't question it, if we don't talk about it, we're never gonna really change it.
Is there anything biological there, or is it all societal?
I don't think we have had any, I mean, the brain makes these associations that, we associate words and characters we learn, like our brain learns. So I think
Yeah.
it's mostly environmental and social, and it's a learned behavior. Because, and the reason why I think it's mostly learned behavior is because our interventions to reduce weight bias focus mostly on education. And if you educate somebody about the causes of obesity, the complex causes of obesity, we're able to change beliefs about obesity, and that actually reduces weight bias.
Yeah.
So I think it's that misunderstanding, misconception of obesity that we have. And I don't think we're born with biased
Well, I think
weight bias.
I think we've seen examples throughout history of how different weights have been viewed differently. Like, if you look at paintings of women in the
Yeah.
1500s,
Yeah.
they were larger. They were
Yeah.
still viewed as beautiful. In fact, they were the pinnacle of beauty. There's different groups that have seen larger women as sexier and more beautiful. I think we're at the our North American bias is probably the least healthy, when all of the all of the models are just not healthy
realistic.
people. They're not realistic people.
They're not.
You're literally searching for a group, an individual that's a size that's just not average by any stretch,
No,
like just not even close.
no.
And then those people, models, then have their own issues when they become, the only thing that they matter for then becomes that weight, that size, that odds are they're not going to be able to keep for the rest of their lives. So their career that they've chosen is over for most of them in their mid-20s, if not 30 years old. They're done, right? So it's not a healthy way for any of us to look at how our clothes should fit, what we should look like. None of that's achievable for any of us. When you talk of weight bias, is that mostly obesity, or is underweight something that you guys look at as well? Those people that are just chronically underweight and have been treated away because of that.
Yeah, I think Obesity Canada is focused on the bias that people with obesity experience.
Yeah.
But we also recognize that there is a bias against people who live in smaller bodies as well. And there's a lot of research in that area. That's not my expertise.
Yeah.
But one of the things that we were working on with last year was a group of activists in Canada were trying to change the Human Rights Act in Manitoba to try to protect against size discrimination. So,
Absolutely.
size is not obesity, right?
Yeah.
But because people with obesity have larger body size, we supported those efforts because it overlaps with obesity. But they were arguing that you shouldn't be discriminated in the workplace or in education or in the healthcare system because of your size. And they looked at size from both ends, like larger and smaller as well. So it doesn't matter if you're short, tall, big, small. You should be treated with respect like any other Canadian. Just like we in the Human Rights Act, we have protections against racism and ageism. They just wanted to add this sizeism component to the Human Rights Act. It didn't get passed in Manitoba, and I think they're still pushing for it. And we are very supportive of it because we realize that a lot of the persons living with obesity that we work with, they experience extensive discrimination in the workplace, in the healthcare system. I've heard horrible stories about people going to a hospital and not being able to have their blood pressure measured or having an MRI or getting some specific treatment because of their body size.
Because of their size.
And that's not okay, right? Like if you're a Canadian citizen and you work and you pay taxes and you're an individual that lives in our society, everybody should be able to have healthcare. And it's not okay for somebody to be denied healthcare because of their size.
And do you think that all of these weight bias issues that we've talked about, do they persist in the healthcare system as well?
Yeah, they're very pervasive in the healthcare system. I mean, it's most of the studies that we have is measuring weight bias in the healthcare system amongst healthcare professionals, like amongst doctors, nurses, dietitians, psychologists, you name it, everybody has weight bias. And even hospital administrators, HR, people who work in hospitals, it's very, very pervasive. And that has deep consequences for healthcare practice. So, for example, doctors, nurses will spend less time with patients living with obesity. Nurses, and they think that patients living with obesity are gross and they don't want to touch them. That they're, smelly and lazy, and all these stereotypes are deeply ingrained in the healthcare professionals as well.
Or that they put themselves in this situation.
Like
this is their fault. You're obviously in here with a health problem because you're fat, and you feel less empathy for somebody if that's the way that you're looking at them. Right?
Yeah, so imagine
this is their
you
own
come
fault.
into the emergency room because you were in a car accident.
Yeah.
It wasn't your fault.
No.
But because you have a larger body, the nurses will treat you differently than somebody who was in a car accident that wasn't in a larger body. They will not only treat you differently, they will make you feel bad about your size. And then, the consequence is that people with obesity will avoid the healthcare system at all cost, right? Like, so that has consequences for their health. So if they think they're going to be shamed and blamed by their doctor or their nurse, they're not going to go for a preventative screening test, like cancer screening or, like breast cancer screenings, because they don't want to be shamed. And that means that they're not doing those pre-screenings, and maybe they will develop cancer without us knowing, and they'll go untreated with diseases that should have been screened.
Well, I think one that must be big, and you would know, is just the extent of obesity would be increased by not dealing with it earlier on because of the shame.
Yeah,
You know,
definitely.
you start off with, I don't want to go to the doctor because I'm getting larger.
Mhm.
And then it just gets worse. And then you end up, you're one of those people on the 600-pound life show. And then the mountain that you have to climb to get out of this situation is just extensive. Like,
Yeah.
you
And
know,
in Canada, we have about, it's a lot of people, like almost 10% of people with severe obesity. And there's people
wow.
that you don't see out on the street, right? Like you don't see them because they can't get up.
Yeah.
There's people who are lying in long-term care facilities because they cannot be discharged to their home because they cannot receive home care. There's people, who are not have never been on an airplane, right? And never been able to
Yeah.
visit somebody and their family member because they can't get on the plane. And there's so many, those are like the severe obesity cases and examples, but it still matters because everybody matters.
Yeah.
It doesn't
Absolutely.
matter if you're, weigh 500 pounds or 200 pounds, you should be able to live a good quality of life, and you should be able to get good health care, and you should be able to feel that you're treated with dignity and respect by your doctor, and that you can find evidence-based care. So right now, Obesity Canada's data shows that getting treatment for obesity is almost impossible in our country, right? Like it's very, very difficult. Like some people are waiting for bariatric surgery for 3, 6 years,
Really.
and some people are dying waiting for bariatric surgery.
Because people are looking at it as almost a cosmetic thing.
Yeah,
Is,
and
is, that, is that a
actually,
perception?
bariatric surgery, we don't have enough bariatric surgeons in the country. There's not enough OR time to
Yeah.
have bariatric surgery in the system. Most provinces don't even have a bariatric surgery program. So Alberta, Ontario, BC, and Quebec, they're the provinces that do the most surgeries for bariatric patients. But in other provinces, there's nothing, and people have to go out of the province to
Wow.
go in a wait list somewhere else, and that's difficult. And if you're living in a home, if you're stuck at home and you can't move, how are you gonna ever find access to something?
But for us as a society, it's better for us to give this treatment early on. Would
Yeah,
you?
I definitely believe so. I mean, from a prevention side, obesity prevention is important. Just like if you think about diabetes,
Yeah.
we do prevention and treatment. We try to prevent diabetes. We have a lot of prevention efforts out there. Or cancer, we do cancer prevention. We do hypertension
Yeah.
prevention. In obesity, we talk a lot about prevention, and that prevention aspect is usually distilled down to let's teach people to eat healthy and exercise,
Yeah.
and that's the prevention we do. But if you think about that, healthy eating and exercising is generally good for any chronic disease prevention. That prevents diabetes, it prevents cancer, it prevents hypertension, stroke, cardiovascular diseases. So eating less, eating healthy, and moving more is healthy. It's helpful for everybody. Everybody in Canada, everybody in the world should be exercising more and eating healthy. It's not an obesity prevention strategy.
Yeah.
It's a chronic disease prevention strategy. So our narrative in the country right now is that we just need to prevent obesity by telling people to eat less and move more.
Yeah.
And that has not worked.
No.
And then the consequence of that is that we don't talk about treatment. So we will never have a diabetes strategy that only has treatment or management. We need to do both prevention and treatment.
Yeah.
And so what happens to the 5.5 million Canadians that already have obesity? They need treatments. So sure, we can do prevention, and it should be more than teaching people to eat healthy and exercise for that matter. But we should be doing prevention, but we should also be doing management and treatment and rehabilitation and
Well,
helping people across the lifespan.
one thing I saw on your website is that, is it Health Canada that now classifies obesity as a chronic disease?
Well, Obesity Canada does, and the Canadian Medical
Canadian
Association,
Medical Association. Okay.
obesity as a disease. And the WHO, the World Health Organization, declared obesity as a disease in 1948. It's
Okay.
been a disease in WHO for decades.
But do you think that we're treating it as a country, as a society, as a chronic illness?
No,
No.
we're treating it as a risk factor for other chronic
Illnesses.
illnesses.
Yeah, yeah, yeah.
Right?
Yeah, it's seen
So
as a
if you have
symptom.
obesity, you're going to get diabetes. If
Yeah.
you have obesity, you're going to get cancer. But we don't treat obesity as a disease itself. And that has major implications, right? Because people just think that obesity is not serious enough and that it's just a weight loss thing. But there are major consequences related to obesity. It's a disease that can have a lot of other comorbidities that are not diabetes and cancer or other chronic disease. It has impact on your mobility, on your social health, on your psychological health. There's so many other issues that are affected by obesity that if you don't treat it, it's like, it's kind of like I compare it to in the 80s when we were talking about HIV
Yeah.
being people's fault because
Yeah.
they were having unprotected sex. And so it was their fault, and we don't need to treat it. We just need to give people condoms or teach them not to have unprotected sex.
Yeah.
And that's going to solve the HIV/AIDS epidemic. Well, that didn't work. And so
No.
then we realized actually it's a virus.
Yeah.
So we need to treat it. And then we started doing research and we figured out that there's treatments, and now people can live with HIV in a very good, healthy, good quality of life.
Good quality of life. Yeah. One thing that definitely we kind of touched on that I've seen a lot in my life, and I've seen what it does to people, is people who, when they were younger, were very fit, but when they hit a certain age, like this happened to me slightly, but I watched it happen to some other people rather extensively. When they're very fit as a young age, and then something happens around 25, 24, where they could eat anything, and then all of a sudden the metabolism is just gone. They become very large, and you see that completely change their life. You see that change their career path. You see that change their want to be social, their want to go to social gatherings, their want to be seen by people that they knew in their younger days. I've seen that happen to people that I know, and I think we underestimate the effect that has to these people. They could have, they may have had aspirations for types of jobs where they had to be social, and then all of a sudden it's no, I don't want to, because I don't want them to see me as this. Both women and men who have seen go through this. And then I think for men, I'm not sure if it's easier to talk about for men or women, because I think men are supposed to, I'm just a big guy. I'm supposed to just be a big man, and I'll keep being a big man. And but then
You raised a lot of very, very important issues there. There's a lot of unpacking there. Like, first of all, when we talk about obesity prevention in the government, we tend to focus on childhood obesity prevention.
Yeah.
So all the efforts are going into schools, changing the food environment, getting people more active, kids more active. And that's the prevention efforts that are mostly happening around the world by governments. But the point that you raise is that kids actually, the data that we have is that a lot of people develop obesity after childhood.
Yeah.
Like, it's not during childhood. It's, yes, obviously we have data that childhood obesity exists and it is a problem, and we need to help children who have obesity as well. But the majority of people actually develop obesity later in life. It happens, there's different things that can trigger obesity. For example, getting pregnant, having a baby and not being able to lose the weight afterwards, and then having another baby and then gaining more weight, or losing somebody that you love and going into a depression, starting to take an antidepressive medication that causes weight gain, or you've been a high performance athlete and all of a sudden you get an accident and you
Yeah.
can't compete anymore. And so now you're not exercising at the same level that you were before, but you're eating the same amounts and you develop obesity,
Yeah.
or you experience some kind of trauma. So it can be, there can be so many different reasons why people can develop obesity. It's not just this idea that people are eating too much and are not moving enough when they were children.
Yeah.
That's part of it, but it's not. It does not explain obesity
Well, but
at the population level.
but I mean, we had structure as children as well. We were moving a lot. I mean, I don't know what kids go through today. I don't have children, but I know as a child, for me, I moved a ton when I was a kid, and ate
Mhm.
fairly healthy. I mean, it was a fairly traditional diet, so it wasn't very plant based, but it was healthy because it was natural. And I know for me, when I was in school, we had a lot of sports, so I had a lot of sports. There was structure. I had a lot of good eating because my family made good meals. But as soon as you leave that whole structure, you go out on your own when you're in your 20s, you go to college,
Mhm.
you don't have a ton of money, you don't have a ton of time, you completely change your eating habits, and then physically, that metabolism that used to be just a magical thing no longer is. That slows down for people, and then all of a sudden, one, you don't cook like your family cooked. You don't work out, or you don't have physical activity like you did with gym classes and after school sports, because you didn't, like when you say high performance athlete, I was not a high performance athlete. I was a
Mhm.
medium performance athlete. And so, well, but like, you're a medium performance athlete when you're a kid. It's not something that you continue a ton in your rest of your
No,
life then. So that
no,
goes out of the
yeah.
window. So the amount of physical
And then you were
activity.
stressed in college.
Sorry.
You were stressed in college, all the
Oh
exam
yeah, the
periods,
stress,
right?
everything, absolutely. Yeah, and you didn't make it to college level sports, so you're not doing any of the sports, and you're not eating as you normally would. All of that comes together, and if you don't, you develop a natural habit, even if your habit was good when you were in as a kid.
Yeah. So that's the, I think the point of that is that it can happen to anybody.
Yeah, absolutely.
Right? It doesn't mean that you have to have genetics. It doesn't mean that you have to experience a trauma. It doesn't mean that you have to, have something happen to you that leads to obesity. We know for a fact that after we turn 20, our metabolism starts going down. Every decade, so it sort of slows down. So if you gain 2 pounds every year from your 20s and on,
Yeah,
like it will take effort for you not to gain those 20 pounds, those two
two
pounds, two
pounds.
pounds a
Yeah,
year. It's 2 pounds is not that much. It's 1 kilogram, 1 kilogram a year. If you gain 1 kilogram a year for, 10, 20 years, by the time you're like 40, you will have a lot of excess weight,
yeah,
right? So I think people think, oh, most people gain a lot of weight very rapidly, but it can actually sneak in as well, right? Like,
yeah,
from the time you go start university, you start gaining 2 pounds and 2 pounds every year. And then by the time then you have kids and then you have family and you have stress and something happens, everything compounds to people developing obesity. And I think that's one of the things that misconceptions that we need to do more education out there, that obesity is not an individual's fault. And it is not, weight is not entirely controllable by the individual.
yeah,
There's a lot of uncontrollable factors that mediate weight gain. Just like you cannot control how tall you're going to be, there is a component of uncontrollability in obesity and weight gain. And as a human person, you're going to gain weight every year after your 20s because
yeah.
that's normal. Your body is a normal physiological response. And so if you don't want to do that, then that means that you have to prevent it and you have to exercise and you have to do an effort. You have to eat healthy and try to prevent that weight gain, right? But if you have all this other stuff happening around your life, and like, how I started in my master's and I saw all these people coming from different countries, and, having excited to be in a different country and living a better life and creating a better future. Most of immigrants work 2 or 3 jobs in the first 10 years
Yeah.
before they reach their economic potential, right? And, if you're working 2 or 3 jobs, how healthy can you eat? Because eating healthy takes a lot of work and
Takes a lot of
planning.
work.
Like you should be eating 3 meals a day and it takes 20 minutes to make each meal. That's like 60 minutes. Just planning and making your meals, and then you need to eat for half an hour. That's 3 hours now every day that you need to dedicate to eating and healthy eating and grocery shopping. All of that. And some people don't have 3 hours to
No.
eat healthy,
Well, especially if you've got
right?
kids too. You got children on top
Yeah.
of that. Well, and I think one thing too with that is one of those two or three jobs is probably at a food joint that's not necessarily the healthiest food, right? So you're taking your free employee meal or your cheaper
Yeah.
employee meal,
Yeah.
and it's not healthy because a lot of newcomers end up working in those service industry
That's
jobs
right.
that are at, you know, Tim Hortons.
That's what happens if you
Yeah,
don't, like you come to a new country and it's very difficult to integrate. And if you don't speak English and you're driving a taxi all day or working in a fast food restaurant, and then you're trying to work and be happy and think about all these things, but sometimes it's beyond your control. And I think that's the social scientist in me that thinks we need to stop blaming people.
yeah,
But there is always there's always a component of individual responsibility,
absolutely,
right?
absolutely,
In like in anything, right? So I don't deny the individual responsibility, but in obesity we tend to put all the responsibility on the
the
individual.
individual.
It's like it's
Yeah,
up to you to eat healthy. It's up to you to find treatments. It's up to you to take care of yourself. We are not going to spend healthcare dollars on you because you're not worth it, because you did it to yourself. And the healthcare budget is not big enough to take care of you because you're not as important as a person who has diabetes or cancer or heart disease. That's the narrative that I think we need to change.
yeah,
It's not that we're denying all individual responsibility. It's just that it's part of it, just like individual responsibility is part of diabetes care and cancer care, right? Like we all need to take responsibility for what we do and what we eat, but it's not as easy as we think it is.
So, is there anything legally that needs to change? Do we need to change things when it comes to access of what we bring into the food system here?
Yeah, so there's a lot of people working on food policies and policies at the government level to promote more healthy eating. Health Canada just released a new food guide, and they're working on a front of packaging labeling strategy to help Canadians figure out what's healthy and not healthy. They're doing a lot of education and healthy eating strategies across the country to help people, but it's not just education, it's policies, right? We need to change the way food is available to children and families. We need to start eating more fresh food and fresh vegetables. So how do we make those foods more available? How do we make sure that people in the north have access to fresh vegetables and fruits? And those are policies that need to change, right? Like we need to make healthy food less expensive and more affordable and more available to people. And right now, it can be very expensive to eat healthy, especially if you
Absolutely.
live in the northern communities where there's no access to
Well,
fresh foods.
yeah, when you talk about places like Fort Chipewyan, I don't know how anybody up there would be able to eat healthy. Like it's like $4 an orange, you know,
Hmm.
like which
Yeah, it's
it's expensive for
outrageous.
anything,
And
but
then, if you have only $4 and you can buy 3 bags of potato chips
yeah,
for that versus an orange,
and
you
the
can feed a lot more people with that, right?
and the potato chips are always on sale, and they're always 3 bags for $4, or you know, 8 bags for $7, and you can buy 12 cans of pop. Like there
Yeah, I think
definitely
we do
is.
need policies. We need to stop marketing unhealthy food to children, right? Like, it's as a mom, I go to the grocery store and all the unhealthy foods are colorful at eye level for my child to
Yeah,
see and to nag me every time I
and
go to the
grab.
grocery
Yeah,
store, right? And it shouldn't be like that. It should be the environment needs to change. We need to start changing how we think about food, and there's a lot of policies that can help with that. And I think the government has responsibility in making sure that we have policies that enable people to eat healthy and to live a good quality of life and to have access to healthcare.
yeah,
Like it's not just about treating things; it's also about prevention.
Yeah, absolutely.
But I think from a weight bias perspective, we could also have policies, right? We could have policies about anti-discrimination policies
Absolutely.
against people living with obesity. Like it shouldn't be okay for somebody to get fired because they have obesity. It shouldn't be okay for them to be denied healthcare because they have obesity. And those are policies that we could do at the policy level, at the government level, and then also at the institutional levels. Like in hospitals, we need to do a lot more training to healthcare professionals and educate them about what obesity is. And we need to do weight bias sensitivity training
Yeah.
so that they can change their practice. So, if you, like I said, if you don't know that you have weight bias, you're not going to do anything about it. But as soon as you find out that, yes, your thinking is a little biased and you do believe this and that, and then you start really reflecting at that because healthcare providers, they go into the healthcare field to help people. They don't want to cause more harm. A lot of this stuff is happening in an unintended way, I think, because we're not aware of it.
Yeah. Oh, absolutely. And I think weight bias, as we talked, is probably the most pervasive and most acceptable bias out there.
Yeah. Yeah.
I would say that people don't even question if people have weight bias. I think everybody does to an extent at different levels.
Oh, yeah.
Um,
Like
and
every day, I hear fat jokes.
oh yeah, absolutely.
I have to make an implicit, like in my family, we have very strong discussions about that because there is people in my family that have obesity, and one of my nephews specifically, he had bariatric surgery a few years ago, but he was bullied all his life for being having excess weight, you know, and he's told us stories about how he felt that our family was shaming him
Yeah.
and how we were some of the perpetrators of this weight bias. And so now that I'm more aware of it and now that he's shared his experiences with us, we're all trying to change. But it's very difficult because, as soon as you hear a fat joke, people laugh.
Yeah.
Like we don't even think about it. We just laugh. And so now it's like consciously trying to think, oh my gosh, that is weight bias. We shouldn't be laughing at that. And it's we are helping each other here in my family to try to avoid that. But I go out to anywhere. I can be out for a dinner with a colleague, and a fat joke comes up,
Yeah.
and then it becomes tiring to tell everybody. Like, well, actually, that's not funny, and that's weight bias, and then you become kind of like the weight bias police.
Yeah. Yeah.
And people started like, okay, I'm not gonna hang out with her very much because
Well, it's the same as the vegan at the table. That everybody's tired of hearing the vegan at the table talk about how we shouldn't eat meat, right?
yeah,
You don't want to become that person, but you also want to help to create the change that needs to happen because you don't really know. Even if that person laughs along, you don't even know what that has done to those people. Like I know that we did that as kids. We all did it as kids.
yeah, yeah,
You that was supposed to be your way of having social interaction and social connection with people was, you found the one thing about them that made them different and you pointed at it for a while,
and
and even
that's exactly what stigma and weight bias is, right? Like stigma, the root of the stigma is because we have many other diseases that are stigmatized, like
yeah,
HIV/AIDS and
absolutely.
mental illness, and so I've looked at the research in other areas. But one of the ways that we uh, we engage in stigmatizing behavior is that we try to separate. It's us versus them.
Yeah.
Like you're different than me, and then that gives me power to treat you differently and to treat you unfairly. And then that makes me have higher power and higher status. And so that's why we do it. But if you think about it, we all as humans, just the idea of just existing as a human is about belonging
Well,
and being part of having somebody that you can belong with and having a community and all of that. And so the weight bias that kids experience and the teasing and the bullying, that just makes it such a traumatic experience that it has consequences for the rest of their lives,
absolutely.
forever. And like my nephew still talks about his, he did attempt to commit
Oh,
suicide at one point because he was so alone and isolated. And that's something that we need to change because everybody belongs. Everybody should belong, and everybody should be respected and treated like, you know, dignified human beings. And so
Absolutely.
that is why I do it. And that's, I have a bias because it affected my family. When he attempted to commit suicide, it changed everything for
Yeah.
us, right? And then I did my PhD, which was qualitative, and I talked to many patients living with obesity, and their stories were as horrific or more
Yeah.
horrific than that. The abuse that they've experienced all their lives, and so for me, it's a human rights issue. It's a human issue that we as humans we need to change that. We need to make our world better.
Yeah. And we need to have real conversations with people about how they feel about these things,
Yeah,
you know?
yeah,
Especially when it's happening to the people closest to us.
yeah.
Like you'd think we'd know, but
I know.
we've got to make sure that we're trying to have those the conversations, and not just
Yeah.
going with the surface stuff and the surface jokes because we all bounce the surface jokes back and forth and think it's all right, but a lot of times it's not, you know.
And that's why when you started the conversation today about why you do this podcast, and about you trying to connect with people and to discuss ideas, that's very important because I find that we live in a very shallow society
Absolutely.
and we just treat things very quickly and we don't connect with people. And we are not creating an empathetic world by doing this, right? Like we don't share with each other how we're feeling. We don't talk about our vulnerabilities. We don't talk about how we feel. And I don't want my child, he's 12 years old. I don't want
Yeah.
him to grow up like that. I want him to be able to have connections because I know how human connections are so important for our health and well-being.
Absolutely. Well, we'll end most of this right here. I just have one last thing that I like to do. It's called Read, Watch, and Listen. And I just ask you for one thing that people should read, one thing that they should watch, and one thing they should listen to. Let's start with
Ooh.
read.
Well, I would highly encourage people to go to the Obesity Canada website
All right. As they should, yes.
because there's a lots of information and resources there to learn about what obesity is and to learn about weight bias. What was the second one?
Read, watch, and listen.
Watch. Watch, I would say the TED Talk by Brene Brown.
Okay.
No,
Yep. Renee Brown.
yeah,
Yep.
about vulnerability, about how we need to, really talk about our emotions and our vulnerabilities and share, and to become better people, better to
Yeah.
have a better society.
And listen.
Yeah, and listen to you, to this podcast.
Well, thank you. No, it could be anything. It could be music, something that just brings you joy.
Well, to me, what music brings me joy, but I think just going out there in nature and just listening to nature is
That's
the
cool.
most relaxing thing that I can do.
Absolutely.
And it brings everything into perspective because we're little parts of nature. We're little components of this world and this universe. And going out to nature makes me realize that, we are part of this universe and we need to make sure that we stay together.
Absolutely. Well, Ximena, thank you so much for your time today. Thanks for being a part of the podcast. It was an absolute pleasure talking to you. If people want to learn more, the Obesity Canada website's the place to go.
Yeah, obesitycanada.ca.
Perfect. Thank you very much for your time. Have a great day, and maybe we'll
Thank,
talk to you again soon. Thanks.
thank you, Andrew.